Good afternoon. Happy Saturday. You're listening to the Ask Dr. Ernst Show. Hey, it's a show where pounds are shed, disease is dead, and where you can be set free from your health problems. I'm your host, Dr. Aaron Ernst, and I love that we get to speak with you today. We're here to guide you and coach you, inspire you, and help you to achieve ultimate health. In fact, we're also here to help you become your own doctor so you can heal yourself. You know, we call it the Ask Dr. Ernst Show because you get to ask a question, and we come at you each week with holistic, natural, non-prescriptive, non-conventional treatments that actually work. And today, I want to talk about a really powerful secret for healing. You know, last week, if you listened to my show, we talked about how your mind has a huge control over your matter, your body, and that you might be willing yourself into sickness or disease, or you might be willing yourself into health, healing, abundance, and long life. The choice is yours, but it's what's going on up here in the head. Your thoughts, how you think about yourself, what you say to yourself in your head, you know, those silent thoughts. Whatever you're saying to yourself dictates your well-being. So today I'm going to go from metaphysical thoughts to physical. How does your brain actually help you to heal? And I don't want you to think like that you're going to be, oh, this isn't going to work for me. My brain doesn't work, Dr. Ernst. Like I got brain fog. Well, that's why it's foggy, is because of what I'm going to talk about today. Maybe you have Alzheimer's, dementia, cognitive decline, some sort of brain issue, a neurological disorder, MS, Parkinson's, you name it. You're still able to get your brain to heal your body. We're talking about the physical connection that your brain and spinal cord has. Those of you who are watching our Facebook live feed, look, if you haven't figured it out by now, every week I sit in this studio on Saturday and I pop a camera right there and I push go live. Here's the beauty. Now we're on Instagram, Twitter, YouTube, and Facebook all at the same time. So I can't just say head on over to Facebook. Use our handle, Ask Dr. Ernst, AskDrErnst, and use that on YouTube. So youtube.com/AskDrErnst. Use it on Twitter, twitter.com/AskDrErnst. Use it on Facebook. Use it at Google. Use it at Home Depot if you want. Maybe it'll give you something. I don't know. It's worth a try. But here's the deal. There is research that I'm going to point out to you guys today that shows that your brain has a flow of electricity and energy that runs down through what's called the central portion of the skull, the atlas axis. I know it's heavy terms. I'm going to teach you how to do this, but it flows through this area, and if it's normal and it's centered and aligned, health. If it's abnormal, out of alignment, and that brain stem, the vagal systems, if your cranial nerves are compressed, that's an imbalance that leads to what? Sickness. So let's talk about this, not from a chiropractic perspective, because, you know, I get it all the time. Oh, Dr. Ernst, you're talking about chiropractic now. I did that. I got my neck cracked and nothing changed. That's not what I'm talking about. I'm not talking about the flying seven, the wham dingers, the cracks, the pops, the snaps. I'm not talking about that, guys. That is not even chiropractic by definition. You might be seeing somebody who's cracking your back, but listen, when you crack something, I don't know about you, but it breaks. I don't want my back to break. I want it to be adjusted, realigned. I don't want anything snapped, twisted, popped, cracked, jerked. I don't know, whatever the terms are that you guys use for chiropractic, okay? Unfortunately, I hate saying this because, listen, I have a chiropractic degree. I've got a doctor of natural medicine. I'm a functional certified practitioner. I'm a functional medicine doctor. It's like, I hate saying this because I'm a chiropractor, but a lot of chiropractors don't understand chiropractic. Well, there it is. I said it. I'll just let that marinate. Many of you have come to me saying, man, I've been a chiropractor and they didn't do half of what you did. Well, I'm sorry. There's conventional chiropractic, then there's functional chiropractic. I choose function over convention. I choose function over convenience. I choose function over management. Maybe that's just me. So I've got research upon research. I've got visuals. I've got diagrams. Look at this. I even have x-rays to kind of teach you guys today. Whoa! Who knew you were going to learn so much about your health today by taking a peek at your neck and your back? And here's the deal. So many of you keep emailing us each week going, hey, Dr. Ernst, I watched your show last week. It was great, but I have headaches. What do you do for that? Same thing. I had a prospective patient who bumped into me while I was out and about over the weekend and said, I listened to your show. It's great. And then you know what happens, right? They always come up, so, hey, listen, I've got this, and what would you do for that? And it's like, well, did you listen to the show? Because I just talked about that. Oh, well, like I listened for 4 minutes before, I went somewhere else. I get it. Our attention span is like half you have already left. It's 5 minutes into the show and you're like, what's he talking about today? I can't do this. I'm out. I'm talking about how to get your body to heal by itself. I'm talking about paying attention to what's going on and getting your brain reconnected. I'm talking about the raw power that your mind and your physical brain have over the ability for you to heal. And I'm talking about big stuff today, guys. Heart disease, diabetes, thyroid problems, cancer even, infertility. What? You mean if I can't get pregnant, it could be an issue with my brain? Yeah. So let's talk about it today. Also, listen, we have had an overwhelming response. Last week, I gave out this announcement saying I'm hosting a very special webinar on Saturday, September 12th. I'm going to teach you how to take the metaphysical, your thoughts, hone them in at a vibrational frequency that makes you heal. I'm going to talk about 3 secrets for self-healing. Guys, if these 3 things aren't working, you cannot heal. I'm going to reveal all 3 of them, what you do to fix them, how you test to find out if you have them, and most importantly, I'm going to show you how to become the doctor that you should be. You should heal yourself. You should be the one figuring out what your problem is, not letting your insurance or your medical providers do it for you. It's you. It's your job. So how do you register for that webinar that's coming up on Saturday, the 12th of September? Easy. 2 options. Pick up the phone. Call 704-906-2094. 704-906-2094. Hey, if you're techie, guess what? Text us. 704-906-2094. All we need is your name and your email because your number comes straight through to us. Name and email text. Hey, if you're really savvy, Facebook Messenger us. It's Ask Dr. Ernst on Facebook. Hit the messenger button and send us your name and your email and your phone number, and boom, you're in automatically. It's the 12th of September. Guys, it's right around the corner. 10 a.m. in the comfort of your home. How to heal yourself. Our last webinar had 390 people on it. Why don't you join us, as this one's going to probably go north of that. Again, 704-906-2094. It's the Ask Dr. Ernst Show, how your brain heals you. We'll be right back.
People are the heart of Jordan Essentials, and our products are the cornerstone. 100% of the population needs skincare in some shape or form, and of course there's a lot to choose from. So what makes Jordan Essentials different? We often like to say it's what we don't put in our products. We avoid harmful chemicals and pack our products with natural, botanical, beneficial solutions for you and your family.
Good afternoon. Happy Saturday. Thanks for tuning in today. Whether you're listening on 1110 AM, 993 FM, radio.com, WBT.com, iTunes.com, Facebook.com, YouTube.com, Twitter.com, we're all over. It's the Ask Dr. Ernst Show. It's the show where pounds are shed, disease is dead, and where you can be set free from your health problems. I'm your host, Dr. Aaron Ernst, and we have a really awesome topic, at least I think it is. Hopefully you guys will agree with me as you learn today that your brain is supposed to heal you. Yep, that couple pounds of flesh that sits inside your skull, inside the bones, that's like doing everything for you. Heaven forbid we should question that our brain might be able to fix stuff. I mean, I look at it as a chiropractor and as a functional practitioner saying, wait. Isn't the point of your brain to make your body work? So if there's a misfire or a miscommunication, couldn't that cause you to have high blood pressure, cholesterol, heart disease, diabetes, stroke, MS, Parkinson's, Alzheimer's, cancer? Yes. And listen, the research is evident, which I'm going to share with you today. A couple weeks ago, I had someone email in. Look, you guys can do that if you want. Go to AskDrErnst.com, click on the contact button. You know what they said? Great show, Dr. Ernst, really informative. But where's the science that backs up everything you just said? Hey, we always post it, AskDrErnst.com. I'm going to share it directly with you today. I'll give you the titles of the articles. Listen, nothing that I talk about isn't already proven in research or in clinical practice or in case studies. That's what I bring to you guys is truth, not my own perspective. And that's what we pride ourselves here at Ask Dr. Ernst in doing that. You ask the question. We find the info for you. We bring it to you. Holistic, natural, self-healing techniques. So what is our spine? I mean, hopefully you guys understand this, okay? It's the bones of your neck, your mid-back, and your low back. That's the spinal column, the bones, okay? Can you see them if you take x-rays? Yes. Those of you on Twitter, YouTube, Instagram, and Facebook watching our live stream, if you didn't know we're doing it, Facebook.com Ask Dr. Ernst, YouTube.com Ask Dr. Ernst, Twitter.com Ask Dr. Ernst, Instagram.com/Ask Dr. Ernst, live stream. Watch the videos, guys. If you're in the car, I don't know, pull over, open up your iPad, iPhone, Android, whatever, and hit up the page. This here is an x-ray of somebody's neck. And how do I know it's the neck? Well, I can see their teeth. I can see where their eyeballs sit in their head. I can see the skull, which holds their brain, and then I see all the bones of their neck. Okay, now I'm going to just teach you something real quick. The bones of your spine are designed to surround and protect your spinal cord. Now, why would you want to do that? Well, the cord is the tube. So again, now I'm zooming in a little bit more. Can you guys see this? Okay, bones protect the spinal cord. There are 7 bones in your neck, 12 in your mid-back, 5 in your low back, and they form this column that allows us to stand upright. But more importantly, hopefully I'm centering this, on the inside is the cord, and that little guy right there, that tiny thing, like it's about the size of your thumb in some areas, actually it's more like the size of your pinky in other areas, is the massive wire that takes your brain signal and brings it into your body. So you guys would know this, right? If I just cut right through the spinal cord, depending upon what level I cut it, everything from there down is paralyzed. So here's a trick question. Okay, those of you who can comment, if you're on Facebook, Instagram, YouTube, Twitter, comment. Ready? If I was to cut the cord here at L1, how bad off would I be compared to if I cut it at C1? Somebody tell me, which would you pick? If you had to, like you couldn't leave the room, fine, if I had to pick, go ahead and just sever my spinal cord at L1, doctor, or would you pick C1? Okay, cervical 1 or lumbar 1. I would take this one all day long because you know what? Yeah, I can't use my legs. Yes, I need an enema to go to the bathroom, but hey, my lungs work by themselves, my heart works, my pancreas, my stomach. If I sever here, guys, I'm done. I can't do anything. I can't breathe. I can't think. I can't make my heart beat. The only way to be alive would be like Christopher Reeves, hooked up to multiple machines, making everything work. And listen, there are some of you who view this show frequently know that I'm a believer. So I'm going to share with you my interpretation of why the spine is a mirror image creation of your healing power. 7 bones in the neck. Biblically, 7 is a sign of completion. How many days did it take to make the entire earth? 6, and God rested on the 7th. It's a complete cycle. 6 to get things done, 7 to complete it. Completion. 12. That was the tribes of Israel. That was the number of disciples. Biblically, it stands for totality. So total completeness. Total completeness. 5, the bones in your low back. Biblically, 5 is a sign of grace. Grace is kind of like a gift. It's things that you get that you don't deserve. And thank God we get our health without deserving it. Because if you had to work for your health, many of you wouldn't even be alive today. In fact, so many of you take your health for granted and you let it fall apart. And then you go, I wish I could find it. Like, where did it go? Well, maybe if I throw gobs of money at it, I can get it back. No, even billionaires still lose their health and can't get it back. So completion, all parts of your body, by grace, boom. That's from me, mirror image, okay? Where's the research on that? There isn't any. That's a quote from me. If you want to say, well, who came up with that? I did. Okay, you can either believe it or not. I choose to believe it because, what do you know? To me, it's true. Now, the spinal cord itself is a massive complex of bones, okay? 7 in your neck, 12 in your mid-back, 5 in your low back. Yes, you have a sacrum. Yes, you have a coccyx. All of you analytics, yes. But there's not that very many nerves that come out of those. They do go down to your feet, and they control your feeling in your feet and your toes, but that's about it. So I'm going to focus on organs. Okay, so how do we know what's going on? Well, listen, years and years and years and years ago, It's about 1934, 1940. There was a famous autopsy study called the Windsor autopsies. And that's how they came up with this chart. Now, here's what's really cool. Dr. Windsor actually said, let me find out what people died from. Okay, this person died from heart disease. And he had the forethought in the 30s and 40s to say, let me go and trace the nerves during an autopsy to where they come from and see what's going on in the spine. And he always found an arthritic degenerative change at specific regions when somebody died from, say, said disease. So let me give you an example. If they died from heart disease, there was a very clear degenerative change. I don't know if you can see this. Hey, I'll post this so you guys can see this. It's probably way too small. But the heart nerves are controlled by the second thoracic nerve. Comes out of the middle part of your upper back. What he found out was people who died from heart disease had arthritic degenerative changes at the second thoracic. Well, if they died from liver cancer or gallbladder cancer, it was 4 and 5. If it was stomach, it was 6. If it was your spleen, it was 8. And basically, he mapped it out. He said, okay, these diseases correlate to this area of spinal damage. And so he came up with what was called the spinal organ chart. And it still exists today. It's just called the autonomic nervous system chart. What it means is the area of your body that automatically controls your organs is a neurological system. Man, I hope I didn't go too deep. Do you get this? Okay, can you just think right now, make my blood pressure go down? Some people can, but can you do it? Probably not. Can you think your sugar's up and down? Some people can, but the average person cannot. So we have an automatic system. Our brain controls our breathing without you thinking. It controls your sweat without you having to worry about it. It controls how often you blink. Every single function in your body is automatically controlled by the autonomic system, which is brain getting into body through the spinal cord, but more importantly, how the cord exits the bones of your neck and your back. So again, here's the kicker. So many of you have what's called a subluxation. Guys, what does it mean? Sub means less. Lux means light. Ation is like a collection or a group. A nation is a collection of states or a collection of provinces or whatever you want to call it. A collection of areas. Nation, a collection, okay? Less light collected. Less light in your body. Subluxation, less light. What are they talking about? Light, electricity, power, energy. And guys, that's a medical term, just so you know. This isn't like a chiropractic word. Subluxation is a medical term for a slight misalignment of a spinal bone such that it squeezes or compresses the cord or the nerve, resulting in an irritated, inflamed joint, tight muscles, and a pinched nerve or nerve interference. Do you see where I'm going with this? What if you have a subluxation at the nerve that goes to your heart and you have palpitations, arrhythmias, heart disease? That could be one of your underlying causes. It might not be your diet. Because you know how many people I meet with, they go, Dr. Ernst, I have this arrhythmia or I have this high blood pressure. I went vegan. I worked out 12 times a day and my pressure went up. What's going on? I thought I was healthy. No, that would imply there's something wrong with your spine. If you do all the stuff externally right, you take the supplements that you're supposed to, you exercise like you're supposed to, you fast, you eat well, and nothing's changing, your brain should be going, something wrong with my spine. Now, I know what you're thinking, though. Like, God, wouldn't it hurt? Like, shouldn't I have pain? No. Harvard scientists did a study and found out you have to squeeze that nerve, or whichever nerve is in your body, by 40% its size in order for you to say, ouch. And listen, you should thank those scientists for doing this, because if it was only 1% pinch to feel it, every step you take, every breath you have, it's a song, isn't it? Every step you take, every breath, whatever. My mind is going off. Every single step you take, every breath you have, every heartbeat you have, every movement of your body would hurt if you didn't have a reserve. So number one, thank God for the reserve. Number two, thank those scientists for finding this. But now the problem. If you can't feel it, that doesn't mean you don't have it. So how on earth would we find out if your spine's out of alignment or if you have a subluxation? Well, first, you got to take an x-ray. But in order to then understand it, you got to know what you're looking at. So I'm just going to hone in on a couple things for you guys. Those of you, again, watching on the live stream, please watch. Pay attention. If you're listening to this after hours, comment below and I can help you. If you're on radio, 1110 AM, 993 FM, now's the time to go pull up your phone and go to those channels /Ask Dr. Ernst and watch the videos. Because the only way you can see this is to see it. That bone right there is C1. Here's your brain in your skull, and you see the space here? Man, it has to be open. Open. Let me give you an example. What do you see here? Red circle shows there's no space. So the brain is being squeezed right there. Right there. C1. This is radiographic evidence of what's called spinal subluxation. Normal here, abnormal here. We can physically see on an x-ray the compression. Now, can we measure it? Yes, but it requires other tools. But we can see it. Now, the other thing that I can see here is the red arrows, which I put on this x-ray, say there's arthritis and degeneration and disc damage and disease in this spine. This is an unwell person. But you know what they said to me? Coming into my office, I've done everything right. I've been exercising. I've been working out. I've been changing my diet. I started praying. I started meditating, and my conditions haven't changed at all. And I went, you have got nerve irritation, nerve damage, subluxation. And they said to me, hey, can you just please help me? Take an x-ray. So I showed them this, and I said, okay, I asked people, what do you see here? They're like, I see a space. I can see the bone, and I can see that it's open. Okay, now let me show you yours. What do you see? And most people go like this. Ugh. I don't know if it's because they don't know what they're looking at or it's because they actually understand it and they're going, oh my God, like there it is. I can see it. That means I have to admit to this doctor that I know what's causing my problem and I'm going to have to do something about it. Guess what? Now you can heal yourself. There's techniques to release this that you can do. There's things that we can do structurally as functional chiropractors to help you. But the first step is you got to get tested. You got to see what it looks like. And what I'm going to offer to you guys right now, because here's a commercial, you can hear it, is an opportunity for you to join me to learn more about what I'm talking about today. Look, I only have another half an hour to tell you about 7 hours worth of information. So come to the 12th. It's a Saturday. It's 10 a.m. It's free. There's zero cost. Free. 704-906-2094. Again, 704-906-2094. It's the Ask Dr. Ernst Show. We'll be right back.
So this is the difference between biodynamic and conventional farming. Let's look at the difference in vineyards here. You have very green grass and herbs and life growing, and then dead soil over here. So this is a conventional vineyard where they spray pesticides, they use a lot of tractors to pull up the soil. This soil is dead, it's dry. There's no life. This is Klaus's vineyard. It's farmed biodynamically. Everything is picked by hand and they don't use any chemicals. So there's life, there's green grass, everything grows. This is the big disparity between conventional farming and biodynamic farming, and you can see it perfectly side by side. We prefer this wine, of course, because this wine is dead. There's nothing living in it.
Here's a secret your grocery store does not want you to know. At ThriveMarket.com, get up to 50% off all your organic groceries, delivered to your door for free. Shop organic, non-GMO, gluten-free, and paleo. And get a free jar of coconut oil. Thrive Market. Wholesome products, wholesale prices. Get your free coconut oil today only at ThriveMarket.com.
Happy Saturday. You're listening to the Ask Dr. Ernst Show. I'm your host, Dr. Aaron Ernst. Hey, thanks for tuning in today. We have a really, really, really good conversation going on, not just online through Facebook.com/AskDrErnst, but also Twitter and YouTube and Instagram, because we are now streaming live to multiple stations all at once. Very excited about that. And we're talking today about the concept of how your brain, physical, can heal your body. And last week, if you heard my show, we talked about how your mind, metaphysical, can actually heal your body. But you got to be careful about the way you think. If you think negative thoughts, you get a negative reaction. If you think positive thoughts, you get a positive reaction. We want to turn on the placebo, not the nocebo. If you're interested in that, head on over to iTunes and download our previous podcast. Again, your handle is Ask Dr. Ernst. But today is about the physical. How do we get the brain physically on, active and vibrant and flowing, so it can make our organs work properly? And it has to do with the understanding simply of your alignment. So many of you are walking around with misalignments. They're called subluxations. It's a subtle distortion in the normal pattern of your spine. such that it squeezes the nerve or the spinal cord, and that creates lack of energy. Thus, subluxation, less light to your body. Less lux, lightation, a collection of cells, your entire body. So I want to just focus a little bit on now what does the science say, and also throw out that our call line was busy. So I'm going to reopen it now. You can text it. So you just use 704-906-2094. We need your name and your email if you want to come to our new webinar that's on the 12th of September. So it's like 2 weeks from now. So again, 704-906-2094. Again, just text over your name and your name and your email, because your number comes with it. You can Facebook message us that if you want, or you can just call directly. If you like to speak to a live human being, we have collectors. Not call collectors. That's a bad phrase, isn't it? We have people on the other line that will answer and say, "Hi, are you interested in joining Dr. Ernst for the webinar?" Just say yes and give them your name, your phone number, and your email. 2 ways to fix the spine. And here's what I find interesting, okay? Because there's so many people that have neck pain, back pain, headaches, and musculoskeletal problems, you would assume that we would have solved this by now. At least I would. So there's 2 ways that people deal with. You can go through the conventional medical treatments. And let me just walk you through this, okay? Your back hurts, and you've been taking Advil so long that you're worried that, you should do something about it. You go to your primary, and they usually say stuff like, well, have you been taking Advil and aspirin? Yes, doc, is not doing anything. They might take an x-ray. They might show you something. You have arthritis. You have stenosis. You have scoliosis. I don't know. They'll show it to you. And usually you leave with a stronger than over-the-counter, right? Because it's a prescription. So they'll give you muscle relaxers and pain pills. So this is first line of therapy conventionally, just so you know. If 6 or 8 weeks go by and you're like, hey, doc, it still hurts, they're going to say, well, we got 2 options. I can give you more muscle relaxers and pain pills, stronger ones, better ones, whatever, or I can send you to a specialist, and that'll either be physical therapy or an orthopedist. And so maybe you choose the physical therapy route. And so if you go through that for 6 or 8 weeks and it's still there, which, by the way, it happens quite often, now it's like, well, you're going to the orthopedic, and they're going to do a deeper workup. Maybe they do an MRI, maybe they do something. And, of course, they might find something and tell you have 2 options. You can go back to physical therapy, you can keep taking the drugs, or you can let us do surgery. That's conventional. Now, there's the holistic or functional route, and this would be things like chiropractic, massage, acupuncture, etc. Listen to this. A recent study published in the journal Spine. By the way, this is the coolest journal ever because it's all about your back. Spine. It shows the efficacy of the treatments. Listen to this. At the conclusion of a study, they had people do conventional, they had people do chiropractic. Okay, 94% of the people that sought chiropractic care had 30% reduction in 4 weeks of their pain. 94%. What was it for the medical? 56. So just right there alone in 4 weeks, man, the chiropractic care is crushing medical care for pain. But now watch this. They kept going, and they said, what about 8 weeks? What about 16 weeks? By 16 weeks, 94% of the people that had chiropractic care said they were completely resolved. 3 months. And it was only 30% of those in the medical route. Some other stuff I found. Watch this. A 4-year study. This is a huge one. 1.7 million people. That's a large number of people. They said, I want 1 million people to not see a chiropractor, and I want 700,000 to go see a chiropractor. So they stacked the odds in the favor of medicine by putting more people in the medical group, which is fine. And then they said, we want to see what happens. Ready? How much did these people spend on health care for 4 years? Chiropractic patients, 12% less costs out of pocket for their health expenses. If they had things like, low back pain, etc., 28% lower cost on average going to a chiropractor than going to a doctor. Fewer inpatient stays, 9.3 less stays per 1,000 compared to 15 stays medically. Less MRIs, 43.2 MRIs per 1,000 people instead of 68 MRIs for 1,000 people. Less surgery, 3.3% less low back surgeries compared to 4.3 per 100,000. I'm sorry, 3.3 for 1,000 compared to 4.3 for 1,000. So less people had surgery when they had chiropractic. Less MRIs, less hospital stays, less healthcare costs with chiropractic. And here's the crazy thing. According to the lead doctor, his name is Dr. Nelson, he said that this could save the American healthcare $47 million in 4 years just for these 1 million people. Now, we have how many million people in the U.S.? 300. Take 300 million, times it by 47 million, and you get a massive number that could save the United States tons and tons and tons and tons of money in regards to healthcare if people paid attention to how their brain heals their body. If they would take the pressure off their nerve system and let their brain flow through complete to all parts by grace, their brain would take care of their bodies and say this: health instead of sickness. Alignment instead of misalignment. And guys, we can see this on x-rays so super easy, but you can't feel it. So many of you are listening right now going, I wonder if my whatever could get fixed. It happens, right? What about my headaches, Dr. Ernst? Yes. What about my sinuses? Of course. What about my neck pain? Oh, that's an easy one. What about my back pain? You got it. What about my hard stuff like diabetes? Yep. Thyroid? Yes. Cancer? Yes. And if you don't believe me, stick around. The research is very clear. I'm going to share with you clinical studies published of people getting back on their life from getting chiropractic care, releasing their brain and spinal cord, taking that pinchado area, right, for all of you Hispanics and those who speak Spanish, pinchado right there. Get that out. Get that pinch out. Get that brain opened up. Get it flowing through the neck. It'll clear the arthritis over time. The body is able to do that. If it can break a bone and heal, why can't it do that? But see, the medicine will say, no, there's no way for arthritis to go away because they don't change brain to spine positions. Hey, it's the Ask Dr. Ernst Show. Call lines are open. If you want to join me for my next webinar, Saturday the 12th of September, 10 a.m., it's How to Heal Yourself, 3 Secrets for Self-Healing, 704-906-2094. Call it, text it. All we need is your information. We'll be right back. It's the Ask Dr. Ernst Show. Don't go anywhere.
Greetings, it's Todd, the founder of Dry Farm Wines. The most common question we get from wine drinkers: how is it that your wines are sugar-free? Well, here's the story. Wine grapes are full of sugar at harvest. Sugar is needed for fermentation, where yeast feed on it to transform that sugar into alcohol. The yeast keep eating the sugar until there isn't any left, and the yeast die naturally, which completes fermentation. The result is a dry, sugar-free wine. That's how natural wines we source are made. However, most wines are not made that way. Commercial winemakers often stop fermentation prematurely by adding sulfur dioxide to the wine to kill the yeast, leaving residual sugar behind in their wines. Commercial winemakers do this all the time. We only source and drink fully fermented wines with less than 1 gram per liter of sugar. And statistically, that's sugar-free. And the only way to really know if a wine is sugar-free is to lab test it. And that's why Dry Farm Wines lab test every wine to ensure it is sugar-free.
Here's a secret your grocery store does not want you to know. At ThriveMarket.com, get up to 50% off all your organic groceries delivered to your door for free. Shop organic, non-GMO, gluten-free, and paleo. And get a free jar of coconut oil. Thrive Market. Wholesome products, wholesale prices. Get your free coconut oil today only at ThriveMarket.com.
Good afternoon. Happy Saturday to you. You're listening to the Ask Dr. Ernst Show. I'm your host, Dr. Aaron Ernst, and yes, this is a show where pounds are shed, disease is dead, and where you can be set free from your health problems. Hey, look, did you know that your spine is involved in weight loss? Yeah, guess what? There's a scientific study being done up in New York. I don't know if they paused it because of COVID right now, but before COVID, there were several medical doctors that were actually putting electrical implants onto your vagus nerve, which, by the way, comes out right there, right between the skull and the first bone. Vagal cranial nerve comes out right there. And what this medical doctor found out was if they gave it a little juice, like a zap it, then people would lose weight. And this medical doctor went, wow, vagal nerve stimulation results in weight loss. Wow. So if you want to sign up for that, go online and Google search vagal nerve stimulator. It's about $10,000. And they have to do it surgically, so they got to open up the back of your neck, and they got to slide this little wire in and stick it on the nerve, and then they give you a little button, almost like a key fob. It's almost kind of like, okay, here's my key fob. They just go, right? So what happens is they lose weight. Now, I'm here to tell you there is such a better way to stimulate your vagus nerve without the electrical shock and without the massive surgery. It's called Get a Chiropractic Reset. Not chiropractic crack, crack, pop, pop, snap, snap, twist, twist. No. Get a chiropractic adjustment, often using an instrument or some sort of manual table that moves, like a drop table, to go in and open the joints. Okay, so here's the thing. This x-ray shows an example of a patient who gave me permission, I'm not going to use a name, but gave me permission to share their x-rays so I could show you what this looks like when someone comes to my office and has type 2 diabetes and says, Dr. Ernst, I've been dealing with this for years. Can you help me get rid of it? And I went vegan and it didn't change. I became, a CrossFitter. I went to, Gold's Gym. Well, you can't do that right now, but you know what I mean? Like I work out like crazy. And I lost weight, but my sugars didn't get any better. Okay, so they're telling us they changed their diet, they changed their exercises, no results. That tells me, as a functional chiropractor, spine's out of alignment. You know what they said? I don't have any pain in my neck. So I think you're wrong, but I'm willing to come in and see if you're right. So, and here we go. And I showed this to them, and I'm like, okay, first of all, I can't believe you can't feel this. 1, 2, 3, 4 discs that are decayed and degenerative, massive arthritis, no curve in your neck, and vagal nerve compression, evident on x-ray. And they went, what? Say what? I'm like, okay, hold on. This is normal. And I asked my patients, do you see this? Do you see the curve in the neck? Yeah, doc, I do. Do you see those discs? They are open. Oh, wow, yeah, I see that. Do you see these these lines, black lines? That's where the nerves come out. Do you see this hole right here between the skull and the first bone? That's where your vagus nerve sits. So now that you know what it should look like, what do you see here? And again, their faces are like, ugh. Yeah, so is that what's causing my diabetes? Well, it could be. How would we find out? Hopefully you would understand this. If we can test with an adjustment, opening this, re-establishing the neck curve, trying to get you back to this, and your sugars go down, and that's all we did different, does that mean it's causing your diabetes? Somebody tell me in the chat box. Somebody, yeah. Yes? Right? Yes? Yes. Okay, let's stop taking it from just stories to science, all right? I want you to Google this. Quote, resolution of type 2 diabetes in patients undergoing subluxation-based chiropractic care. A case study. Subluxation-based chiropractic care. What does that mean? That means we're not adjusting them for pain. We're looking for this subluxation. We're looking for the pinched nerve that we can't do based off pain. You can't say my neck hurts, so I must be subluxated here. Nope. You got to take an x-ray and find it. So this says resolution, meaning the goodbye diabetes, resolution of type 2 diabetes in a patient undergoing subluxation-based care. Listen to this story. Ready? A 61-year-old male came to a chiropractor. 20-year history of type 2 diabetes, which means at 41 years old, he found out he was a type 2 diabetic. Subluxations were located on x-rays and corrected with manual therapies, meaning he got an adjustment. Okay, what does it say here? Chiropractic adjustments were delivered to the spine manually at the areas of vertebral subluxation. How'd they know where they were? They took an x-ray, they analyzed the angles, and they adjusted off the x-rays. Now listen to this. After 1 month of treatment, 4 weeks, and no changes to diet other than what the patient had already changed, they were able to stop their medications completely. And after 2 months of chiropractic care, returned back to the medical doctor who confirmed blood glucose levels had normalized. conclusion, I'm going to read it directly. Chiropractic care and the dietary modifications this patient made previously with a 20-year history of type 2 diabetes resulted in resolution of his diagnosis. Boom! Diabetes gone. Okay, what about infertility? Maybe you are having difficulty getting pregnant and you haven't thought about the fact that your uterus and ovaries are connected, or male, like your parts are connected to your spine. I had a patient once say, wait, that thing's connected? Yes, it is. Okay, everything's connected to your spine. Nerves control everything. So ladies, your ovaries, the uterus, the ability for you to secrete hormones, release an egg, have a fertility, environment, and have everything work on your end, that's your spine. Guys, same thing, just different parts. All right, so watch this. Healthy pregnancy following chiropractic care in a patient with previous ovarian cancer. This is huge. After just 2 years of being infertile. 28-year-old woman with a 2-year history of infertility. So guys, she had ovarian cancer and couldn't get pregnant. Patient presented to the office seeking care for fertility and also mentioned having low back pain. Including in the initial exam was an orthopedic, neurological, and radiological assessment. So they did the exam and they found areas of subluxation. A treatment plan was developed using chiropractic techniques. Ready for the conclusion? Patient conceived naturally following 14 sessions of chiropractic care. That could be as little as a month or as long as 2 months if you're going twice a week, once a week, 3 times a week, etc. Patient carried out a full-term pregnancy and continued chiropractic care throughout. Chiropractic care could facilitate the increase in the automatic functions of fertility, is the conclusion of the study. So yeah, you got to remember, this woman had cancer in her ovary and had it removed, only had one left, and was having a hard time getting pregnant, and then got 14 adjustments. Boom. I don't know about you, but I've worked with a lot of women who've been trying to get pregnant, and they've done multitudes of things, including all kinds of IVF that is very expensive and very detrimental to your body. It's a lot of hormones being injected. It's a lot of, you got to harvest eggs. You got to put multitudes in there and just pray to God that only one takes, not 16. You know what I mean? It's tough. How about if you have high blood pressure? Google this. Reduction in arterial blood pressure following adjustment of atlas to correct vertebral subluxation. Oh, that's a big phrase, isn't it? The atlas is your first bone in your neck. What they're saying is that they did an adjustment to fix the atlas, center it so the brain would flow straight down the spinal cord. And what happened? Well, here we go. 20 participants were examined radiographically and determined what their atlas looked like. How far out of alignment was it? The therapeutic group, so they split them, received an actual adjustment. Well, the other group received a fake adjustment. It felt like they were being adjusted, but the doctor didn't actually apply the force in the direction needed to correct it. And it said subsequently they followed up with them, okay? The therapeutic group, those who received the adjustments, demonstrated significant lowering in systolic pressure after 6 weeks of therapy. Guys, 6 weeks to lower your blood pressure. That's phenomenal. The effect on diastolic was reached after just 4 weeks. So their lung pressure dropped after 4 weeks and their body's pressure dropped after 6 weeks. Now listen, this is where it gets really good. There was absolutely zero statistical significance in those who received the sham adjustments. So the fake adjustment didn't work, but the real adjustment worked. And I hate to say this, a lot of you are getting fake sham adjustments. I hate to say it, but there's a lot of chiropractors who are just like, well, let's just get something to move. Did you hear that? I did. That was good. It was an adjustment. Yeah, that's not a real functional adjustment. Specific, isolated to one region, analyzed by x-ray, reanalyzed by x-ray to confirm that it changes, use of thermography, use of palpation, use of orthopedic exams. Little different. What did the conclusion say? This provides evidence that correcting upper cervical atlas misalignments can regulate arterial blood pressure. Wow. Okay, let's go deeper. What about thyroid problems? This is a hormone issue, right? How does your brain fix your hormones, especially with thyroid? 52-year-old female. No, again, I'm sorry, I forgot. What do you type into Google to go find this? Resolution of hypothyroidism and improved cervical curve in a 52-year-old female undergoing chiropractic care. Whew. Okay, listen, I'll read it to you. A 52-year-old female presented for chiropractic care with a chief complaint of discomfort and paresthesia, numbness, tingling, in her neck, upper back, and along the sides of her spine, mid-back, knee pain, and hip pain while sitting. Whew, this woman's got it hard, right? She was previously diagnosed with hypothyroidism by her medical doctor and was taking medications for thyroid. Now listen, after 9 months of regular chiropractic, guys, 9 months is not a long time to fix hormones, just so you know. After 9 months of regular chiropractic care, the patient reported her blood work indicated she no longer had hypothyroidism, and her medical doctor said, you're off your meds now. 6-month follow-up. 6 months later, retested. Levels of TSH were normal, no medications. Patient was still under chiropractic care for maintenance. So the 9 months of chiropractic care got rid of this person's thyroid issues, and 6 months of sustained chiropractic care kept it away for that entire time frame. What about IBS? 32-year-old male, female, ready? Resolution of irritable bowel symptomatology in patient undergoing upper cervical chiropractic care. What does upper cervical chiropractic care mean? It means they're fixing the upper area of your neck. Almost all of you have an upper cervical misalignment. Skull to atlas is off. How can you see that physically? Well, if you look in the mirror and your head's tilting to the side, or one eye is lower than the other, or one ear is lower than the other, the best way is to pull out your driver's license and take a look. If you're sitting there like this, because listen, we never smile in those, right? You can't. And number two, they half the time look like mugshots. So if you're sitting there and your mugshot's like this, or it's like this, or one ear is whatever, you can see that you have an atlas misalignment. Resolution of irritable bowel symptomatology in patient undergoing upper cervical chiropractic care. 32-year-old female who suffered from IBS for 10 years, who also had painful runny bowel movements. Sorry, I'm just reading. Discomfort and bloating was noted almost every day, and she said that her symptoms were made worse by stress, alcohol, and large meals with fatty food. She received chiropractic care. The patient reported that she also was depressed and anxious. And upper cervical chiropractic care resolved her IBS, and it says also resolved her depression and her anxiety. Final one. I don't know if we can do this or not. We do. We have plenty of time. People with chronic neck pain and back pain that went to see chiropractors were less likely to take opioids. Now, I don't know if you guys know this or not. Like the opioid and the prescription pain issues that are going on today, it's a massive epidemic. Research from data of 6 published studies found 62,000 people with spinal pain, and if they got chiropractic care, it was up to a 51% less use of pain pills. If they saw a chiropractor, 64% less likely to use the opioids they were on. 64%! Like, that's a phenomenal number. Look, chiropractic could solve the pain epidemic. Chiropractic can solve IBS. Chiropractic can solve thyroid. Chiropractic can solve acid reflux. Chiropractic can solve diabetes. Chiropractic can solve insomnia, infertility, blood pressure. Look at this. It's all over the place, and yet you think it's about neck pain and back pain. Well, we're running out of time. So you know what that means. Call lines are open, 704-906-2094. Call it, text it. The 12th of September is my next webinar. It's at 10 a.m. It's free. I'd like to show you how to heal yourself. Don't forget, it's time to check your atlas. Time to check your alignment. Go from sickness to health. Seek out a chiropractor who's a functional doctor. If you need help, we're there for you. AskDrErnst.com. I'll see you guys next week. Until then, adios.